Good morning, everyone. We will get started shortly as everyone gets online. And thank you for joining us. Abene, Achahala, Hanalswa, Nahanso Kage, Achahala. Greetings, everyone. Um, My name is Trudy Jackson. I'm the Community Engagement Coordinator in Phoenix, Arizona. I just want to welcome each and every one of you to the Indigenous Health Topic. I'm an enrolled member of the Navajo Nation. She ya todi chin shloma bet ani bashes chin na kada nasha chase gun so eight dashanala eight ya Dinenchla. Greetings, everyone. I just introduced myself in my four clans, and that's how we always greet each other wherever us guys are at. So, with that said, I just want to welcome each and every one of you to the Indigenous Health Topic for April 17th, 2026. And please feel free to put your information over in the chat box, and then we will um, go over a brief overview. Um, so just a short housekeeping is someone is saying that they're not able to hear me. Can you hear me now? Okay, thank you. So just some quick housekeeping is introduce yourself over in the chat box, and we will have time at the end of the presentation for Q&A. So if you have any questions, just put it over in the chat box, and then we will look through them and then also ask the presenter. Next slide. So with that, it is a great honor to introduce our featured guest speaker, Josie, um, who is Navajo, Diné, and then she will be talking about films in Indigenous cancer health, engaging Two-Spirit and the Indigenous LGBT communities. And with no further ado, I'm going to hand it over to Josie.
Okay, hello everyone. Can you hear me okay? We're good? All right. Well, wonderful. Thank you so much for the introduction. And thank you for the invitation to join the Indigenous Health Topic series. I've had a couple of other colleagues from my team who have been able to present here, and they really enjoyed this space as well. So I just really appreciate the resource that this group provides for education and the platform for health promotion and network building. So yes, I please extend the invitation to share where you're joining from, ask questions throughout. Looking forward to the conversation after the presentation. But again, thank you, Trudy and team, for inviting me to join you today. So again, just wanted to thank those who were able to join us online. I'm sure there are others who might be trickling in a little bit later, and that's great, and hopefully something that we can share with folks who weren't able to make it, as it could be posted again later. This is an exciting opportunity, and for me to be able to introduce our Department of Indigenous Cancer Health, which is located at Roswell Park, Comprehensive Cancer Center. I also, want to spend some time identifying some gaps in some of our populations that we'll discuss a bit more, and really highlighting the importance of identity when it comes to cancer health and accessing education and resources. And if you're someone who saw film in the title of this presentation and excited about that aspect of it, we will be talking about a specific film project that our department co-led, and then we'll share that clip as well before we talk about next steps and open it up to discussion. So that's kind of what we will be reviewing today, and looking forward to having you all here. So before I jump in, I'll introduce myself a little bit more. So similar to Trudy, I'm a citizen of the Navajo Nation. So she Josie Raphaelito Yinshia, Bilagana Nishlito Hatsoy Bashashin, Ado Bilagana E Dashache Do Torgoja E Dashanele, Clochina Dine E Adonasha. So I am from Raymond, Navajo, New Mexico. And there's a photo up here on the right-hand side of the screen at the top, which is located about 2 hours west of Albuquerque, New Mexico. And similarly, we just introduce ourselves to share our 4 clans. And, my mom is German, Swedish, Scandinavian. And my dad is Middle People Clan, and my paternal grandfather is Saltwater Clan, and that is how I am Dene. And really proud of where I come from. And I use she, her pronouns. And my background is in public health and health policy. And so although I'll be sharing a little bit of research side of the work that we do, I'm in the role of supporting our researchers here in our department and across different networks, and bring that public health lens to the conversation. I also serve as a Two-Spirit and Native LGBTQ plus advocate. So I identify as a queer Dinehetsa, or a Dineh woman. And really couldn't do this type of work without acknowledging our other Two-Spirit and our Native LGBTQ relatives who, have been doing the hard work of educating folks, of bringing people together, and continuing to make sure that our voices and our identities are not left out of the conversation in important conversations like today when we talk about health topics within our Indigenous communities. I currently serve as the Assistant Director of the Department of Indigenous Cancer Health at Roswell Park Comprehensive Cancer Center. So the photo underneath my on the lower right hand of your screen is a photo of downtown Buffalo, New York, which is where I currently reside. And so it's just a complete, just juxtaposition, it looks like here, where I'm from, where I grew up, where I was raised versus where I am now. But lots of different lessons learned, lived experiences that really bring me into this space today to be able to share with you the work that we do here at Roswell Park. So to continue the introductions, I thought I would share a bit more about Roswell Park, which is a comprehensive cancer center, again, located in Buffalo, New York. So most often when I introduce myself and tell folks I'm originally from New Mexico and that I work at Roswell Park, they often think of Roswell, New Mexico. So just to build some clarity, not Roswell, New Mexico, but Roswell Park in Buffalo. And it was founded in 1898, and it's the nation's first cancer center. And so, we are designated by the National Cancer Institute. So we're an NCI designated cancer center. There are more than 72, I believe, across the country. And so we were the first ones here in Buffalo. And we're actually the only comprehensive cancer center in the state of New York. But our mission, is similar to other cancer centers where we are really working to eliminate cancer's grip on humanity. We do that through personalized approaches, and making sure that we maintain that power of hope in the work that we do. So when we talk about, comprehensive cancer work, that includes, access to cancer screening, clinical care, clinical trials and research, also creating pathways to education for students, for researchers, to continue this work and to continue to build on what's being created when it comes to cancer care. And then we also have a care network. So although we are based, we have our main hospital, an area where I'm calling it from now, is in downtown Buffalo. We have a network that spans across the state of New York, throughout Western New York and even up into Northern New York, where we're able to partner up with other clinical sites to also, extend the work that we do and the services that are provided to communities, both in rural and urban settings. I also wanted to mention that although we're in downtown Buffalo, we recognize that we're situated on traditional Haudenosaunee land. So Haudenosaunee is, some folks may have heard of the Six Nations or the Iroquois Confederacy. This is the word Haudenosaunee is loosely translated to the people of the Longhouse. And so that includes the six different nations across Western New York that really build together strong relations and connection to this area. And so, at Roswell Park, we make sure that we acknowledge the land that our main campus is situated on, and work in partnership with the local tribal nations in the work that we do. And so, I would be remiss not to mention and acknowledge our department chair, Dr. Rodney Herring. He has been a true advocate and a leader here at Roswell Park for more than a decade when he first started here, as a young researcher, and really envisioned a time where there would be more Indigenous researchers, more Indigenous physicians and team members to help elevate the representation here at Roswell Park and in the cancer health field, to better support our Indigenous communities. And so, we have really followed in Dr. Herring's vision and his thought process behind that. And here we are today, 2026, and we have a full department of Indigenous cancer health here at Roswell Park, that we initially started as a center in 2020, have blossomed into this incredible team of ours that's just dedicated and committed to the work that we do to serve our communities. So, our mission is to honor the values of Indigenous knowledge, sovereignty, and respect for the environment through community-driven partnerships, collaborative research, and education to reduce the impact of cancer on Indigenous communities. And yes, we're here in Western New York, and we do a lot of work regionally, but we also do work nationally, across the country, and internationally as well, because we like to make sure that we're able to provide support and partnership to relatives who are, across borders and across waters, especially since we're located so closely to Canada. So, the work that we do, I'll be happy to share a link for folks who want to read a little bit more about our department. But, our focus is really on cancer prevention, and behavioral intervention. We listen and learn from our community members and honor what they're sharing in terms of advice on where we should be guiding our research, guiding our services. And that also includes supporting our community members through the cancer care continuum, whether that's screening through survivorship. We have Indigenous patient navigators who support our community members through those processes. We promote cancer screenings within our communities, and we also provide summer research experience opportunities, both to high school and college students, and host postdocs as well. So we really try to, listen to community, they help guide our work and our vision, and really proud of what's been built thus far. So when I joined our team in 2020, I had brought with me a lot of experiences working directly with tribal nations across the country and hearing from community members in terms of, health priorities and areas that needed more attention and more resources. And found myself in many different circles with other Two-Spirit and Native LGBTQ plus community members and leaders. And so, have been in this area of work and found myself at Roswell Park and asking the question, how are we engaging and working with and listening to our Two-Spirit and Native LGBTQ plus relatives? What does that look like? And luckily, I have such an incredible team, folks who may be tuning in right now, and a great support and leadership at Roswell Park, where they welcomed that idea and that concept with open arms and said, you know what, we could be doing more. Let's do this. How do we move forward? And so, together as a team, we challenge ourselves and the work that we do, whether it's education and outreach, whether that's adapting materials or having focused conversations at events or gatherings like today, being able to open that conversation and learn from one another and help create more spotlight on areas that's needed. And so when I asked that question, of course, like as any public health professional would do, we looked for the data to get us started and asking, what does the population look like when we talk about our Two-Spirit and Native LGBTQ plus relatives? So folks online may be asking the same questions, and there might be other researchers that would have so much more to share, and I'd be happy to receive some additional guidance and resources. But in doing a little bit of our own, it was really identifying that there was a gap here. But what we had turned towards, and something I wanted to highlight here, is that the LGBTQ population in general is growing. So the most recent estimates from the Gallup poll are up from 5.6% in 2020, and we're now at 7.6% and rising. And when we look at the Gen Z population, we're seeing that there are more and more folks who are identifying within this community. So, which is exciting, and knowing that, okay, as we kind of think forward and plan ahead in our programming and our work in any type of field, that this population is here and growing, and a population that cannot be overlooked. So there's also the National Cancer Survey. That is a photo of one of the reports here on the right-hand side. They reached out to 1,200 cancer survivors in 2021, and they do their reports as often as they're able to, as data allows. And they also specifically reached out and collected responses from BIPOC survey participants, so Black, Indigenous, people of color, and specifically able to pull a report together to highlight what they were hearing from that specific community. So just listing here, some of the top cancers that were listed out of that report being breast cancer, prostate, colorectal, anal, and skin cancer. And so looking at the median age of diagnosis was around age 49. And I think another big highlight here that I wanted to share is, within this given community, you're also asking about what are the experiences when you're trying to access cancer health care. What are some of those encounters? What do they look like? Are they positive and are they negative? And this report was able to highlight what some of those disparities are when it comes to those encounters, whether it's at diagnosis, care, or treatment. And a big one is, was there access to culturally competent providers or frontline staff who were able to support them and greet them and welcome them into that cancer health setting? So in some of these responses, they were summarizing that the BIPOC respondents were 2 times as likely to be dissatisfied with cancer treatment, compared to the white and Latinx respondents. And some of the health settings here were described as less welcoming after those who are, coming into that healthcare center, disclosing themselves as part of the LGBTQ community. So, from these little snippets here, we can understand that there's, some challenges, but there's still also some very big gaps in some of this data. In that, when we talk about BIPOC, that's a very large group. And it leads me to ask, what about the specific data from Indigenous populations? How is this data being collected? Is it being collected if we're asking about Indigenous populations? And if not, why? Why is it not being collected? So, although our colleagues are doing their best to include us in these types of surveys and these reports, there's definitely more work to be done. And a lot of that work needs to be done at home in our Indigenous communities to build safety, to build understanding, and to educate all of our relatives about Two-Spirit and Native LGBTQ plus relatives. So if we're able to collect that at a more local level and allow and invite and acknowledge people who are in these communities to be able to share that identity in important spaces like a healthcare setting area, that's going to go a long way in really sharing the story about the experience of Two-Spirit and LGBTQ plus communities in the cancer health setting. So if we put in the work, if we don't put in the work, we'll continue to be systemically left out and be marginalized. And we need to call attention to all of our relatives when we have the platform like we do today. So true to that message, we need to continue defining terms and encourage that storytelling. So just wanted to share some of the terms listed here. If some folks are new to the term Two-Spirit, it is an umbrella term created by and for Indigenous peoples, and it is describing the gender spectrums and the spectrums of sexual orientation. And the term refers to the collective tribal names of people who with culturally and spiritually distinct genders as recognized in our own tribal nations, our own languages, and our own cultures. So something that's important to note and hope to not cause too much confusion, that not all Indigenous people within the LGBTQIA plus population identify as Two-Spirit. And identifying as Two-Spirit is a personal choice, and it's rooted in one's nation, again, our teachings and lived experience. So if in the way that I communicate this work and I share these different terms, I'm very mindful to say Two-Spirit and Native LGBTQ plus, so that there is that distinction in the way that we're talking about our relatives. And for those who are not as familiar with this beautiful long acronym, just wanted to be able to provide brief definitions to the LGBTQIA plus conversation here. And I think because we're also talking a little bit about research and cancer health settings, you might also hear of something new that's the sexual and gender minorities, or SGM. And that's really the research term to discuss sexual and gender minority populations, which would include our Two-Spirit and Native LGBTQ plus communities. One other acronym I would put out there in case you're wanting more. We also include SOGI when we talk about health data, and this is sexual orientation and gender identity that describes population data for our communities. So there's a lot of different acronyms, a lot of different identities, but at the end of the day, it's really wanting to build understanding, build those connections, and become more and more familiar with the different terms that are being used across our communities and, of course, in cancer health research. So you might be asking, why is this identity so important? Or how will I use this information? Where do we even start when we're talking about building understanding? So, a person's sexual orientation and their gender identity, really can influence or compound an individual's cancer risk factors. And I think something else that's super important is, understanding these intersections of being Indigenous and sharing your sexual orientation or your gender identity. Sharing that in a healthcare setting can really help providers and research in many different ways. But a couple highlighted here is really understanding how to adapt health promotion and prevention efforts that speak specifically to these communities. It also creates more opportunity to provide excellent patient-centered quality health care. So making sure you're listening to the patient and how they identify and what their needs are. Um, but also creates a research space that builds cancer health knowledge. Again, that is inclusive of all of our community members. So, we within our department, when I mentioned that I had asked that question, what are we doing to engage all of our relatives? And we responded in a way where we spent some time listening to our Two-Spirit and our Native LGBTQ plus community members and asking them, how our existing cancer health messaging and health promotion resources, how are they speaking to them? Or how are they not speaking to them? What can we be doing better? And so, we were hearing very loud and clear that they wanted to see more representation from their communities specifically, from our community specifically. And they wanted us to say the quiet part out loud. So if we're talking about cancer health, instead of trying to go about it in a different way, it's calling it cancer health. And so that's something that we heard very loud and clear. And we, as a team, decided, what are some different ways that we can include um, uh, this type of feedback into our existing work. So before I dive right in, I'll share a little bit about our series called Films in Indigenous Cancer Health. And, this really started from the idea and the knowing and understanding that we want to make sure that we highlight the A in STEAM or STEM, which can sometimes be left out. So the STEM field, when possible, it's helpful to include art as the A in STEAM, to really highlight and acknowledge the different ways that art forms help influence science, technology, are embedded throughout our healthcare practices, through our math, and as Indigenous people, how we bring different practices and art into the work that we do. And so Dr. Herring from our team, our chair, is also a co-director of a health communication shared resource at Roswell Park with Paul Hodge. And, they really believe in the power of film and the power of bringing together different networks to collaborate in health messaging and how to bring these stories, these ideas, these conversations about cancer health into short films that can be taken back to community. And so we were able to partner up with a handful of different networks to help create some really wonderful short films focused on different cancer types. And this is over the course of a few years, including some Indigenous talent management teams as well. So some folks might recognize the two faces that are on this screen. We were able to partner up with Gary Farmer, who, if people are familiar with, Smoke Signals, or more recently, Resident Alien, he's just like an amazing Native actor who, was really invested in supporting our work and helping to, just elevate the conversation about cancer health and cancer screening. So he's a partner who we were able to engage and be part of some of these short films. Underneath his photo is Ganadio Horn, who is Mohawk and has been in reservation dogs, res dogs as well, among many other short films and featured films. She, really, again, aligned with our mission and what we wanted to do, and joined us for some conversations about breast cancer screening and prevention. So yes, it's great that we have these folks involved. Yes, it's great that we were able to create these films, but how do we get it out there? How do we make sure people are actually seeing and hearing and being a part of this conversation? So another element to these films in Indigenous cancer health is to utilize their platforms and their social media whether it's Facebook, Instagram, TikTok, anything else that they wanted to use to get these short films out, they were able to utilize their platforms to do that. We have a department Facebook page, which we love, and we post as much as we can. But we know that these types of influencers really do have a much wider network that will bring more attention to the messaging that we're putting together. So that as an example, and through the frameworks that we had created through the Films for Indigenous Cancer Health, we started thinking about, well, we're hearing from community that they want more representation from our Two-Spirit relatives. This would be a perfect opportunity to do that. So we applied for and got a short grant from the federal government to do just that, to have a very focused conversation in identifying an Indigenous influencer, which from the Two-Spirit or Native LGBTQ plus community. Work together with our film production team, was previously mentioned. But to make it a tad bit more fun, we also thought, let's utilize some additional in-house resources with our medical illustrators here at Roswell Park. And let's add some animation to these films. That would be another fun way to get this messaging out. And on top of that, I also mentioned that we have our Indigenous patient navigators. So we wanted to make sure that they had a chance to be involved in the filmmaking and part of the messaging to help educate our influencers, especially if after they're going through the process of the film and the messaging themselves wanted to sign up or learn more about screening or have a relative connect with one of our navigators. So that was an added element. And then, again, utilizing the influencers platforms to disseminate the films online. So this is kind of, through our trial and error, through a lot of collaboration, a lot of lessons learned, this is something that we really thought was an innovative approach to getting cancer health messaging out there. So that said, I thought I would go ahead and introduce to you Kairyn Potts, or Kai Potts, who's this incredible influencer who is Nakota Sioux from Treaty 6 territory. So they are in Canada. Like I mentioned, we do partner with folks across borders and waters. So Kai is north of us, near Toronto. And, he's a proud Two-Spirit person. And he's an Indigenous content creator. So, when I mentioned, kind of the reach and the network that these influencers bring with them into this work, mentioned here, Kai has 560,000 plus followers across different platforms, which is much, much larger than what we have within our department. So being able to partner with someone like Kai is an incredible way for us to expand and enhance and amplify the work. So if you haven't seen Kai or heard about his work, I'd encourage you to take a look. He's a very fun, energetic, very real, honest, and powerful voice for our communities. So introducing Kairyn Potts. Next up is, I'm sure you all are like, okay, Josie, this is great to learn about, to hear about from you, but I'm really interested in the film. So we're going to go ahead and pull up the video. I'm hoping that the audio does come through. We did test it, but please, Trudy or others, pause me in case it doesn't. But this film is about 8 minutes long. So please, if you need to grab some sparkling water or some tea, now would be a good time to do it. And we can just tune into this together.
I consider myself to be a community member with a lot of responsibility. I don't take the term and the identity of Two-Spirit very lightly. And when I tell people that I'm Two-Spirit, I have a responsibility, a role to play in my community of being somebody that is an educator, but also somebody that kind of bridges different worlds. Where I grew up has definitely had an impact on the way that I think about cancer screening. Because I was able to grow up both on reserve and off reserve. We talked about cancer every once in a while, but we didn't talk about what we can do to stop cancer. Anytime we talked about cancer, it was like because we found out somebody had just gotten diagnosed. My motivation to get screened is because I want to honor my mom's memory. She had cancer and ended up passing from it when I was quite young, and I just think about what if she had that info? What if she had supporters? What if she had a patient navigator who was really caring? I think that could have made a world of difference for her. And I can't bring my mom back, obviously, but what I can do is I can look after myself and I can honor her memory by making sure I'm taking my health into my own hands and I'm getting screened and I'm making sure that I know the most about my health at all points in my life.
My name is April Seymour. I'm an Indigenous patient navigator. I am from Akwesasne and Mohawk Nation, which is in upstate New York. And I work with my Akwesasnono on territory at St. Regis Milk Health Services as a patient navigator.
It's so lovely to meet you, April. My name is Kairyn, and yeah, I'm so excited to be learning with you today. This is stuff that I'm not super well versed in, and so I'm just so excited to hear what you do and how I can get involved.
So all of our Indigenous patient navigators, they're supportive, confidential, knowledgeable, very caring, and will do anything to help you with what you need on this journey. Calling them, reminding them, educating them on the phone, so that's also part of navigation too.
Yeah, and of those people, a good number of them could have colon cancer, and second most leading cause of death.
Yep.
Wow.
And it can be easily prevented by getting your regular screenings done.
Yeah. People need to know this stuff.
Yes.
Because I didn't even know. Oh my gosh.
Yes.
It's not how I would like to spend my evening, but so important. And you said that I should be getting it, depending on my family history, at least, every couple of years, 3 years.
Every 3 years, starting at the age of 45.
Right, okay, yes. Awesome. So I should be telling my, uncles and my...
Yes.
Or actually anybody.
Anybody.
Yeah. I didn't know that. And now that I'm thinking about it, I'm like, I don't know of any of my family members that go and, get regular testing like that. Wait. I've never seen anything like this. What is this?
This is Nolan, the inflatable colon.
Oh, he has a name.
Yes.
Quite the setup you guys got here. So wait, Nolan, look, so we're inside the colon right now.
Yes.
Wow. Okay, well, this is new to me, so I cannot wait.
So when a colonoscopy is done, this is what a normal colon tissue looks like. So see how it's pink, smooth, very fleshy? So that's normal. We'll go over here and see what the polyps is that we discussed earlier. So it's a fleshy growth in the lining of the colon. They're discovered through the colonoscopy that we talked about earlier. They're commonly benign, which is non-cancerous. However, if they're untreated, a polyp can develop into colorectal cancer. So over here, this is where we have the malignant polyp. As you can see, it's red, it's inflamed. The polyps are cancerous at this point, and there's a lot of cell disruption.
Yeah, absolutely. I mean, this does not look good. And we have not caught it in early prevention.
Yeah,
this person didn't get a colonoscopy.
Yes.
And now we're here.
Yes.
Right.
In the same procedure.
Okay, got it. Wow. Yeah. So I'm here in the colon, and I've learned so much already, but I kind of want to take a closer look. So let's go check it out. Today, getting a colonoscopy is probably the best bet and best practice when it comes to screening for colorectal cancer. However, if you're like me, maybe you don't really want to go to a hospital, or maybe you live in a rural community where it's difficult to get to. Well, then there are other options like at-home testing with Cologuard, which you can actually have mailed right to your door, and you send the test back to the lab, and actually the lab will contact your healthcare provider. Or you could do the FIT test, where you go into a clinic and pick it up there. There are so many options available, but the key takeaway is that it's very, very important to get regularly tested. But I really want to reframe what we did today for our young people and not see it so much as we need to be resilient, but focus on the life promotion behind it, instead of the scary thoughts that we might have cancer and we may end up perishing from it. Maybe we need to look at it from a perspective of, let's empower ourselves. Let's focus on all of the things in our life that we're grateful for, and see this as just one of those natural things that we do in our day-to-day life to ensure that we're around for our young people and we're around for the generations to come. And not see it as being resilient, but seeing it as being proactive and seeing it as self-care.
I hope you enjoyed that short film. Kai and April did a great job. Most of that we were able to shoot within one day, taking a trip up to Toronto. Nolan Colin is an international traveler now, needs a passport. So we, really enjoyed that process, and so grateful that Kai is going to be able to share this message. And actually, this is probably a very good sneak peek for those who are joining today. Kai most recently on his Instagram had a little sneak peek trailer about this film, and teasing folks that the full film will be shared soon. So that will be coming up within the next week or so. So you can keep an eye out for Kai's social and seeing how he helps us get the word out. So, we will continue to do our best to continue this type of messaging, learning from what's been done, hearing feedback from colleagues like those joining us today. How else can we, fine tune or adjust or, grow on what we've created thus far? In October, which is Liver Cancer Awareness Month, we actually do have a second film that's going to be premiered with another Two-Spirit influencer to help us support that conversation, because liver cancer, there's a lot of prevention that we can talk about, a lot of holistic approaches to prevention. So please keep an eye out for that. If you want to learn more, do please feel free to reach out to us as well. I will put it in the link in our conversation where you can find the film and share with your networks, because that will be available on our department's YouTube playlist. And then, of course, you can also find it through Kai's social media posts. Another area that I wanted to make sure that I highlight, two of them. One is Native Circle, which is the Cancer Information Resource Center and Learning Exchange. That's something that we house within our department, and does provide a whole range of different cancer health resources and messaging for providers, for community outreach team members, for patient navigators or community members. So you can take a look on our website, go to Native Circle, and see what resources are available. If you yourself have something that you'd like to see shared on Native Circle, you can send it to us. We'll take a look and find the best place to put it within Native Circle. And there will be some additional Two-Spirit and Indigenous LGBTQ plus resources within that platform as well. Shout out to ACAP, the American Indian Cancer Foundation, who has done some incredible infographics and flyers as well that help with chest and breast cancer screening messaging, as well as lung cancer and tobacco cessation. Some really, really great resources from their team as well. You can follow our Facebook page to, continue alongside us in this journey, and whether it's film, new research articles or manuscripts that come out. But also we'll be highlighting very soon an online book that just got published by Springer Nature. And here's a little image of the front of the book, Indigenous Genetics, Biobanking, Chemistry, and Cancer Research. So Dr. Herring, our department chair, was lead on that and worked across several different colleagues and co-authors to pull this together. And there's a very specific chapter, chapter 5, that I worked with Dr. Dornell Pete and Lenny Hayes, Lenny Hayes, who is a good friend of mine, to start these conversations about cancer health and Indigenous sexual and gender minorities. So some of the data shared in this conversation, you would find again in this chapter, as well as different recommendations on to community members, providers, researchers, on how to continue to do better and to do more to support all of our relatives. So that really is the key takeaway, is to be a good relative. And, we don't say that lightly. We are all in these different, workspaces, whether it's cancer health or public health or community outreach, whatever that might be. But it really is about building those connections, listening and learning, and finding ways to bring folks in who have often been left out of the discussions. And so I would just challenge each of us to create change in our own areas of expertise. So, here's some examples that you could, offer training to colleagues to build understanding of Two-Spirit and Indigenous LGBTQ plus communities. It's something that, our team, we do, every so often when we have new team members join us. There's some great short films and resources I'd be happy to share, and great colleagues who do what you would mainly call like a general Two-Spirit 101 for different fields of work. Another one is you can invite Two-Spirit and Indigenous LGBTQ plus relatives to join community advisory boards for additional guidance and perspective and to help build inclusion in your own work that you're doing. Again, you can promote patient-centered care and train staff and help create those safer spaces within our healthcare settings to be ready to acknowledge and receive and respect those who come through the doors to access care. Similar to the example I shared today about, adapting community outreach materials, that goes a long way in building inclusion and, showing that you're making the effort to give representation to communities that can often be left out. And, I think in this kind of time that we're in our country, it's also identifying safe opportunities to include these conversations and include questions about sexual orientation and gender identity when it comes to data collection. That fear is very real for our communities and folks being able to share their full identities and their authentic selves. So when we do this work, it's also making sure that we go the extra mile to make sure we're safe in asking those questions and how that information is stored and where it's shared, and being very mindful in how we communicate that with those who are able and brave enough to be able to participate in those types of data collection efforts. But ultimately, we really do have to get creative and, again, center those efforts around safety and inclusion. This project itself was such a joy to be a part of. Our entire team was fully invested and ready to provide feedback and guidance from the script to the influencer to the animation. We just have such a great team that helps see these ideas and the ideas for creativity and bringing them to life. So just want to thank them again for all their support that they offer in this effort to be inclusive and to support one another. So that was a short and sweet way to introduce our department, our Roswell Park work, the ways that we're building inclusion and utilizing the A in STEAM and bringing some of these stories and voices to life through short film. So that concludes my part of this part of the presentation, and happy to take questions or continue the conversation online with everyone. So yeah, thank you.
Thank you again for your amazing presentation, as well as sharing the film. So just looking at any other questions in the Q&A.
Yes, there's a question that says, are you making shorter versions of the video for sharing on social media?
Great question. Yes, we are. It's being part of this film team was so much fun. I came in just as an advisor and as someone to kind of see the project through and coordinate details here and there, but got much more involved than I thought I would have. So seeing the different approaches was really, really interesting because we from the get-go knew that this film was going to be highlighted and featured through social media. And we know the bandwidth of folks who are on social media and how much, the few seconds, if you will, to grab attention and to keep attention was very much in mind. And so we do have at least up to 4 different versions of the film that have those key points that we want to make sure people take home when they see it on Instagram or on Facebook. So yes, we do. And if anyone has recommendations or you're like, oh, I know the sweet spot of the time frame to aim for, please let me know. Be happy to take that advice into consideration too. Thank you.
One other question is, when was Two-Spirit term started? What was the previous term used in Native culture?
Yeah, another great question. So the term Two-Spirit was more or less organized in the 1990s. There was the gay American Indian movement that was happening across North America and of course into Canada. And advocates and leaders were coming together and, having conversations about, the larger LGBTQ movement that was happening and how, yes, there was some connection to that, but there was still very much a separate conversation and understanding happening within our with Indigenous communities, and that there was a need to focus on that a bit more and to have some distinction. And so, although Two-Spirit is an umbrella term, you take that term and you dive deeper and you are able to connect with different tribal nations, again, with our own languages and understanding the traditional stories of community roles, of gender roles, of the languages, the terms that are used for different genders and identities. And so, talking across 576 different federally recognized tribes in all the different languages, we'll each have our own understandings and our own teachings. And I will say that some of us are very lucky if we are still able to hear those terms be used to describe different genders and identities. Not every nation still holds those stories. They may be revitalizing or reestablishing what terms they would want to use in their own language, but it's not a given. So, me as a person, I feel very, very lucky to have been shared some of those stories and hear those words of the different terms that are used. So, yeah, there's a great video that if you were to go to YouTube and just in the search bar, what does Two-Spirit mean? They have a really great short film that provides a lot of condensed historical context and then to how the term was created to then also what does it mean today. So really, really good one. I would highly recommend for folks who want to learn more.
That's awesome to hear. Thank you so much. So, are there any more questions? If not, I just had one question. I know that with the MMIW event that's coming up, I saw something from Canada since you work closely with our Indigenous folks up to the north that they did one where it was that MMIWG Two Spirit LGBTQQIA plus. That was something, that was interesting. So the Q is for queer and questioning. And I was thinking to myself, like, well, yeah, is that something that, you guys may consider incorporating into your next projects?
Yeah, definitely something to consider and to learn more. Yeah, it's interesting that you talk about the two Qs, because that's something that we're learning a little bit more about as well. We had a flyer. I had a clip of it in one of our slides where there was most recently, it was March 20th or 21st. There was a Two-Spirit Awareness Day, a National Two-Spirit Awareness Day. And I was working with some of my colleagues to find ways to share that within our Roswell Park network and doing some deeper dives. And we're able to learn a bit more about, Canada's reach with First Nations and including the Q and Q, so the queer and questioning, but even more so, also a newer flag that they have created up north to celebrate Two-Spirit identities too. So definitely lots to continue to learn and incorporate, and would love to chat more about that, Trudy.
Thank you. Thank you
Trudy,
so much. Yes.
we do have a few more questions that have come in. One is, are you wearing strawberry earrings? Your earrings are a hot topic.
Yes.
And second, the question is, what are some disparities that the Two-Spirit community faces that we should know about regarding cancer care and prevention?
Yeah, great questions. And it's great because Trudy and I were also talking about this a little bit more before we went live. But yeah, I think first and foremost, the one big issue that I would highlight, and I mentioned earlier, is just the access to data. So in order to really understand the disparities that exist, kind of have to have the data to back that up and share that story. So one big issue is that the SOGI data, sexual orientation and gender identity, is not always being collected in a healthcare setting and a cancer care setting. If it is being collected, it can often be limited and does not include identities for Indigenous populations. So that's first and foremost a big issue. But there are good conversations happening when it comes to access to cancer screening generally for Two-Spirit and LGBTQ community members, that they see disparities, whether it's colorectal cancer or if it's chest and breast cancer screenings. So we know that is an area that we know there are disparities, but again, like the numbers aren't there to like fully pinpoint. I think we're definitely trying, and I know there are researchers who will continue to drill down on that a bit more. And then, when it comes to prevention, any disparities, I think it's really important to note that our Indigenous communities which sounds interesting to say in 2026, but still coming to terms with our, Indigenous sexual orientation and gender identities, and how they were very much here and respected and understood pre-contact. And so colonization continues to influence a lot of the different ways in how in how our communities are perceived. So I think that there's a lot of room for growth and a lot of healing and a lot of reestablishing what those traditional roles are and rebuilding that respect.
Okay. So thank you very much for your amazing presentation as well as all of your amazing questions. So please be sure to complete the short survey and provide your feedback. That will be greatly appreciated. And our next Indigenous Health topic will be on May 15th, and we'll be inviting a survivor, Christina Li- Liastra, and she will be sharing her journey over with the team. So on behalf of the Indigenous Health Topic team, we thank our amazing speaker, as well as each and every one of you for joining us, and may you all walk in beauty.
Yeah. Thank you so much.
Wow. So is it like the second one or the third one down? Second one, right?